Diabetes mellitus is a condition where your body isn't able to process the excess glucose in your body. This leads to accumulation of glucose in the bloodstream. There are two forms of diabetes. The form of diabetes depends on your insulin function. Insulin is responsible for processing excess glucose into glycogen. In type 2 diabetes, your body resists insulin. This is the most common, with 90 to 95% of diabetes patients having this type. While in type 1 diabetes, the pancreas doesn't produce enough insulin needed for processing glucose. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. But educating yourself about diabetes and taking steps to prevent or manage it can help you protect your health. Causes. The cause of diabetes, regardless of the type, is having too much glucose circulating in your bloodstream. However, the reason why your blood glucose levels are high differs depending on the type of diabetes. Causes of type 1 diabetes. This is an immune system disease. Your body attacks and destroys insulin-producing cells in your pancreas. Without insulin to allow glucose to enter your cells, glucose builds up in your bloodstream. Also, a virus may trigger the immune system attack. Causes of type 2 diabetes. Your body's cells don't allow insulin to work as it should to let glucose into its cells. Your body's cells have become resistant to insulin. Your pancreas can't keep up and make enough insulin to overcome this resistance. Glucose levels rise in your bloodstream. Gestational diabetes. Hormones produced by the placenta during your pregnancy make your body's cells more resistant to insulin. Your pancreas can't make enough insulin to overcome this resistance. Too much glucose remains in your bloodstream. Symptoms. The general symptoms of diabetes include 1. Increased thirst. 2. Weak, tired feeling. 3. Blurred vision. 4. Slow healing sores or cuts. 5. Unplanned weight loss. 6. Frequent urination. Also, women may experience urinary tract infections and men will have a decreased sex drive. Prevention. Lifestyle measures have been shown to be effective in preventing or delaying the onset of diabetes. To help prevent diabetes and its complications, people should do the following. 1. Achieve and maintain a healthy body weight. 2. Be physically active, doing at least 30 minutes of regular, moderate-intensity activity on most days. More activity is required for weight control. 3. Eat a healthy diet, avoiding sugar and saturated fats. 4. Avoid tobacco use. Smoking increases the risk of diabetes and cardiovascular disease. Treatment. Inexpensive testing of blood glucose is available for early detection of diabetes. Treatment of diabetes involves diet and physical activity along with lowering of blood glucose and the levels of other known risk factors that damage blood vessels. Some common treatment methods include blood glucose control, particularly in type 1 diabetes, blood pressure control, blood lipid control, and screening and treatment of retinopathy. Latest news. In April 2021, we launched the Global Diabetes Compact, a global initiative aiming for sustained improvements in diabetes prevention and care, with a particular focus on supporting low- and middle-income countries. The compact is bringing together all stakeholders to work on a shared vision of reducing the risk of diabetes and ensuring that all people who are diagnosed with diabetes have access to equitable, comprehensive, affordable and quality treatment and care. Healthy living is a lifestyle.